Somebody said to me, I don't trust you because you're in government. And I responded and I said, you should trust me the most because I'm in government because I don't trust it either. That's like the point, that as you're feeling bullied, like this is the moment that you're going to persevere. And that through that perseverance, you will create a place where it's not safe for bullies to do this to people anymore. And so don't give up.
Welcome to Power Beyond Pride. I am one of your hosts for the day, Mattie Bynum. I am having a great day. Wonderful, sitting here in the studio, a Great Idea studio, and that with my co-host, Shane Lukas. Yes, I did say a great idea because this is like the Great Idea.
This is a great idea. Thank you. And I'm Shane Lukas, lifelong harm reduction and bodily autonomy activist, as well as the gayest man at your dream wedding. True facts. Now, we are your co-host, Mattie and I are your co-host on today's Queercast journey, and we have an incredibly special guest today here at the Great Idea Studio. We're live. We are talking with the phenomenal Dr. Demetre Daskalakis, and we are so excited for him to be here because in addition to being an infectious disease physician, he's been an unflinching advocate for LGBTQ plus health and has also served in leadership at the CDC as well as in New York City. So again, incredible. He's leading the work to end HIV. Now, I've been a huge fan of Dr. Demetre for a very long time because he's always provocative but incredibly salient about the work that helps us rethink how we look at HIV prevention and treatment and just gay men's health and queer health in general. And I think it's really powerful, including that around community care. So I want to welcome you to Power Beyond Pride, Dr. Demetre Daskalakis, and how important and incredible it is to have your voice here in this particular moment, in this particular time in our culture.
Well, thank you so much for having me. I am the most wonderful piece of meat in the sandwich. I'm so excited.
Dr. Demetre, Dr. Sexy.
And I'm going to say your name 100 times.
It is so good. I was laughing because I was like, if you put one more medical term in his name, yes, we know.
But well, your bio is so many things. How do you narrow it down for like a Sniffy's ad? Like, how do you narrow that down?
I think public health daddy.
Public health daddy. There we go. Daddy.
Who's your daddy? Public health daddy. Okay. All right. I like that.
Simple.
Perfect.
PH daddy. I love it. Oh. Okay, so our first question is going to be, so you stepped into the national leadership at the CDC to continue the trajectory of ending HIV during one of the most intense public health periods in modern history. What was it like balancing multiple public health emergencies at the same time?
Yeah, I think it's such a good question. The hard part is like we actually probably didn't balance some of the emergencies at the same time, right? So that's like the part that we just have to be really frank about. When I started in New York City Department of Health, it was in an era where we got like a huge amount of funding from the city and the state. And the story is that they were going to give us like $13-14 million. And then one day they said, we're going to double that to end the HIV epidemic. But you have a day to figure out what you're going to do with the other $13 million. And so it was like a dream come true.
Yeah.
Right. So it was like, let's do all the things that we could never do. Like we made a program that supported transgender health organizations to be able to actually grow. And one of them, Destination Tomorrow, one of my favorite organizations that I got to work with, went from a very small organization to a really big one. And then even started working in Atlanta where I used to live. So it was great. And then like things like a crystal meth program and all of that, things that we didn't have in New York. And so everything was going great. The people were doing better with HIV. The numbers were getting better, like viral suppression. The amount of people who were healthy with HIV was going up and up. And then COVID hit. Mm-hmm. And that was like just threw cold water on the whole thing because everyone's attention had to be on the pandemic. And so, so that was hard. And so going to CDC and leading the HIV work was like about trying to, bring that emphasis back, even in the story of all of the, frankly, national public health emergency that was happening. And so I was able to do that for a while. I wasn't in that space very long because they pulled me right out of HIV into COVID because apparently I'm good at that. So they pulled me into that space. And so it really has, I think, been a struggle to make sure that we continue the same drumbeat and emphasis on HIV treatment and prevention.
I love that. No, I appreciate that. And Destination Tomorrow is an amazing program. We had our guest, Dominique Jackson, got some of her early work in community organizing through Destination Tomorrow. And I know you and her have a history as well.
Yeah. Shout out Dominique. I mean, I love her so much. I mean, I think we've got great pictures at a gala that we went to recently together, or we were at the same gala, but we looked like we were prom dates. I mean, that would be a great prom date.
Hey, so just tall, sexual, gorgeous, beautiful.
Good. And like the loveliest human in the world.
Yes, yes.
I met Dominique when she was doing outreach sort of the HIV space. I'm never going to forget. She had like her autobiography that she self-published that she was selling out of the back of her car. And she's like, do you want this? And I was like, of course. And like, I still have it at my house. And I look at it, it's got like her signature with the heart and like her phone number. And we've been friends ever since. And so huge shout out to Dominique.
A big fan society here. So we love her, and we appreciate all the work that you've done. In the work that you've done, you've made a very public statement about why you left the CDC.
Yeah.
We were so excited to see you there, and it was important work that you're doing. And then with the ascension of RFK Jr., basically it feels like public health has now been more political than ever.
Yeah.
Right. So you've been vocal about what the anti-science approach means for public health and guidance in vaccines. And I feel like beyond that, fully. So should queer people be looking at alternative systems or like local health networks or other strategies for info because CDC decisions feel like violence to trans and queer people?
Yeah. I mean, it hurts me to say it. In the era where the organization is being silenced at best and weaponized at worst, I think it's not a credible source of information for most of our community. And so I think that what happens is that we need to look to the community to protect the community, right? And so that means whether it's the medical providers or community organizations, local health jurisdictions, I think that the thing that we're seeing is that even though it would have been easier to not have to do it, like we have to be the people that differentiate the signal from the noise, like the truth from just what's not true. And so it's a lot more work and it's hard, but it's, I think, muscle memory. We're familiar. We've been there, done that in the LGBTQ community. And so I think we're there again. And so I'm going to say probably the answer is you can't really trust what's coming out of the federal government, especially when they're trying to erase your community.
Yeah.
And so like, we're seeing surveillance information, like the data that we need to understand what's happening with diseases have like gender identity or race and all this stuff. And so if you can't trust part of it, you probably can't trust all of it. And so look to your doctors, look to your clinicians, your community run organizations to really help you navigate.
Should we be creating something different? Should we be looking to, again, as somebody who, like you, started doing a lot of activist work in the 1990s, when there was a need to look outside of existing systems, should queer people be looking to construct systems?
Yeah, I think one of the things in my work, I made lots of different families. I have my family in HIV, my family in LGBTQ health, and now I have this family in vaccine. Like I said, who would have thought that the guy who used to go to bathhouses and do HIV testing would be friends with all the pediatricians in the country, but here we, right? It makes great sense.
Yeah.
Here we are. And so I look to them because the attacks on vaccines have been so substantial that what they're doing now is creating these new systems of looking at the data and communicating information in a way that I think that LGBTQ folks and queer health folks need to be inspired by. Like we need our own like council of elders of people that can sort of review what's happening and give us good guidance that's independent of the federal government. Because again, if they're trying to like erase or destroy you in terms of a community, it's going to be hard to believe that they've got your best interest at heart.
100%.
So I have a question. I want to piggyback off of
Yeah.
Okay, so when we talk about communities and talk about people being eliminated, we think about a lot of gender affirming care.
Yeah.
Okay. So I just, yes or no. That's
Okay.
all I need you to do. I just need you to answer.
You want me to keep talking? Just a yes or no?
Just a yes or for right now. Just for right now. Little blue pills for old white men who can't keep their dick hard. Gender affirming care, yes or no?
Yes.
Okay. Breast implants for women who don't have full coverage. Gender affirming care?
Yes.
Okay. What about if a man gets a hair transplant like Donald Trump? Is that gender affirming care?
I have booked my trip to Turkey. Yes.
Okay. And also, too, if a person is on hormone replacement therapy, going through menopause, that's
Gender affirming
care.
Yes.
Also, if you are on hormone replacement therapy and you are transitioning, would that not be considered gender affirming care?
All of the above.
So it's very safe to say that gender affirming care is not just the LGBTQ plus community.
That's 100%.
So if we get rid of gender affirming care, it's not just us that's going to get hurt.
Yeah.
It's everybody.
There's going to be a lot of limp white men.
You heard it first here. Look here. Thank you. Should I say?
Affirming care. No, again, really, but what you're hitting on is really important, right? Because it is a weaponization of so much conversation around, what they're really trying to do is, again, create a transphobic environment.
Yes.
And that's polluting any actual public health conversations, right?
Yeah.
Because it is taking this idea that we could come across another pandemic, we could come across another public health emergency, and they now politicize all these spaces to conflate different relationships that are really built on bias, that are built on prejudice, and basically start to have people tap out from listening to this stuff, because you can tell, and that goes across our communities, our Latina community members, other community members who feel like they are being targeted by a lot of these systems.
No, 100%. I mean, I think that the challenge is going to be that sort of the destabilization that they've done to public health, the attack on vaccines, the attack on just healthcare. I mean, let's just be frank. Like, what they're really doing is they're trying to create a rift between like medicine and the people that we take care of. And they're trying to insert in between us a bunch of wellness grifters that are promoting things that have no data and no evidence in a system that doesn't have any regulation. That's just going to mean money in the bank. Yes. And so like what we need to do as like people who receive care, as well as people that give care, is say that that is a bunch of garbage, and just be very clear that like when you have a get ready, Surgeon General candidate that is being discussed, who doesn't have a medical license, never practiced, and would rather sell you vitamins than remind you how important vaccinations are. We need to have people like us, my council of elders, the people who say that is a bunch of bull and don't believe it. And here's why. I think that is sort of where we are. And the problem is that the damage that's happened to the system. So yeah, maybe they're trying to make you feel like you shouldn't vaccinate your kids, but like that permeates everything. Yeah. What the hell is going to happen if we have another thing where we need to have a mass vaccination campaign in the country, and you have like some percentage of the country that says vaccines don't work or vaccines are evil? This is highly problematic.
100%.
Well, this is how you weaponize the medical system.
Yeah, which is why we've learned it's so easy to do.
Yes, very much so.
So easy to do.
Sadly. Okay, so I do want to go back to before you became Dr. Demetre.
Yeah.
How did miniature, I can't say little because you were never really little. You've always been a big...
I was a giant.
Yes. So how did mini Demetre become Dr. Demetre today?
Yeah. So I had no one around me who was a doctor, but so I would have to attribute the beginning of my ascent into the giant that I am today. Giant, just get over
here. I had to turn for that one.
It had to be that my parents got me a Fisher-Price doctor's kit.
Okay.
And that was my first thing where I was like, I want to do this. And I remember people used to come into my house to visit my parents, and I would walk up with my doctor's kit and say, I want to take your blood pressure and your temperature. And if they said no, I would give them their coats and say, well, you have to leave again. That is not informed consent. And that's but I was not yet. I was just a wee lad. Like I didn't know about her.
I loved you as a kid.
I was persnickety. But definitely that's how it started. And then I started doing the things that you do to get into medicine. So I ended up going to college in New York, and I was pre-med, but also I was a biology and religion double major. And
religion?
Yeah. Not fun.
It's an interesting combination.
It was really good. And so when I was in New York, I moved to New York in 1991, and I was a baby gay, and I landed there, and it was like, oh my God, it's crazy here, and started going out in the clubs and the underground and all of that stuff. And I would literally meet people and get to know them, and then I wouldn't see them anymore. And they would end up being admitted to Bellevue or St. Vincent's. And then I would find out that they were either very sick or they passed away. And so it went from this abstract thing, I want to be a doctor, just more real. And then I helped run a big AIDS memorial quilt display. And, there I saw the people that were coming for the quilt that were so sick. I remember sort of standing on College Walk at Columbia and deciding there that my mission, my North Star, was going to be to make sure that people didn't get or suffer from HIV anymore. And so my whole career launched from there.
That's beautiful.
Yeah.
That is powerful. And I can imagine in that era, I'm assuming you were with glow sticks if you were out there doing the clubbing and all of that.
So a New York City club kid was platform shoes. And
How about the thing
that was like after, that was like the raver era came, that kind of raver was after my kind of raver. My kind of raver was club kid raver.
But I do love this conversation, but we do have to take a quick break. But when we do come back, we do want to have, because there's someone that you know or that you actually came in contact with during the quilt situation. And I definitely want to hear that story.
Yeah, great.
Okay? We'll be right back here at Power Beyond Pride.
Welcome back. This is Power Beyond Pride, a queer change-making podcast, and I have to look at the card to figure out who I am. I am Shane Lucas, and I am here with my amazing and beautiful co-host, Bynum. And we are talking with Dr. Demetre Daskalakis, who is Dr. Demetre, or how do we call him? Dr. Sexy Daddy?
Or Dr. Sugar Pants. No, but Sugar Bridges.
Sugar Bridges.
We have been coming up with a variety of varying names, all of which we will just have to look at.
And what I've learned is I answer to all of them.
You answer to all of them, and we're so glad you're here joining us today.
And each one has a different answer.
And each one,
Yeah.
oh, that's interesting. I like that. So that's good. Okay. All right. Well, there we go. You were, right before break, you were sharing a bit about your history and how you got to be the Dr. Demetre Daddy that you are today, and all of that. I want to go back a little bit to the story around the quilt, which is, again, it sounds like a really pivotal moment in your own history.
Yeah.
And I'd love to hear a little bit about that journey, because, again, having done outreach also in the 90s and having experienced some of what the experience was, where we were talking about a conversation that was still very fresh, very new, where we were dealing with many people who were in early stages of just combating a recent diagnosis. What was that experience like with the quilt? Can you go through a little bit more detail?
Yeah. I mean, it was one of the pivotal moments sort of in my life, and ultimately like sort of set that North Star in my career. So I remember it starts from before the actual display of the quilt on campus, and we had to go to San Francisco to the Names Project, which is who ran the quilt, to the warehouse, because they were going to show us the parts of the quilt we were going to get and just getting us ready for the display. And we were able to bring a piece of the quilt back as a promotion to show that we were bringing it. And so it was walking into that warehouse, it was like this giant teak wood room. And it was like, I just remember it being like very climate controlled, like it was chilly. And all of these pieces of quilt were rolled up in these like shrouds. And so it was like an eerie moment.
So it was heavy in the room.
It was heavy, but you were just like, wow, this is actually so many people have died. And like this whole warehouse is full of these like rolls of cloth that represent them. And they just had this feeling of just the weight of it was great. But so we got to take one piece back. And so they gave me one of the quilts that included Ryan White on it. And so they rolled it up in one of the shrouds and they gave it to me. And then I had to fly back to New York, and everyone was like, oh, you should check it. And I was like, I can't check this. I can't be like, oh, we're just going to check it and I'll pick it up on the carousel. So I was like walking around like the airport in San Francisco, like crying. Wasn't going to be the last time. But anyway, like walking around San Francisco airport crying because I had this thing on my back that was just crazy. And I'm never forgetting that moment. And then seeing the quilt on the ground. And like I said, those folks coming in who are so sick, that's what, like I said, it set that North Star. It's like, no, if I'm going to do this doctor thing, it's going to be to make sure that this doesn't happen to people.
Well, thank you.
And I definitely get that. Yeah, it's a beautiful story.
Yeah.
I know when I first found out about Ryan White, just learning about the foundation and learning about who he was, it was just one of those things where I was like, there's so many people in our past. And this is the thing that we also have to remember is history repeats itself.
Yeah.
Because we talk about medical things now and we talk about different things that are going on in our world, but we have to pay attention that when a community is marginalized, no matter what community it is, it's always going to affect the next person next to you.
Yeah.
In the 90s, it was the AIDS epidemic. And I remember growing up about Philadelphia, and the movie, and just knowing people who, and it was so funny because I remember being at a point at 13 and there was a person that went to church with me. And he had AIDS. I never knew he had AIDS until one day he just stopped coming to church. And I was just like, hey, have you seen Mr. So-and-so? And I remember my aunt was like, yeah, he's sick. And I was like, okay, cool. Like, but is he going to be okay? And she was like, he has. And I was like, he has what? And she was like, he has. And I'm like, well, why are we whispering it?
Yeah.
It's just you and me in the car. And she was like, well, we don't talk about homosexual things. And I'm like, again, why are we whispering it?
Yeah.
Because if it affects one person, it affects all of us. So the thing that really bothers me, especially now with like medical issues that are going on, is geared towards trans people. But I need people to understand that this has been happening many, many years. Like we targeted Black people. Now we're targeting trans. Now we're targeting immigrants. We're targeting so many people. So it's very important. And I know you talk about this a lot too, about standing as an ally, standing with people, because you may not be generally, or you may not be directly affected by HIV, syphilis, STDs or STIs. You may not even be affected generally in a sense where you may not know someone who is gay, which I think that's a lie because everybody knows at least one of the gay people. Just gonna be honest, either they're lying to you or you're lying to yourself.
A very unattractive house.
I'm just being honest. But seriously, I think that this is a season where we need to stand together.
Yeah, no, I think that's right. I think your point of history repeats itself is really important because, again, this is not unfamiliar territory that we're in right now. And I think I keep calling it muscle memory. Like we have the muscle memory to know how to respond to this and how to react because we've kind of been through erasure and communities being downtrodden and folks being told they're not worthy of the care that they deserve. That is like a experience in the LGBTQ community that we've had before. And I think we know what needs to happen.
Absolutely. And I think it brings me to my next question, which is I want to talk to you about parks.
Yeah.
So I want to talk to you about parks. In park, I love them. Who doesn't love a good park?
I don't know. I'm still trying to find a correlation of how that brought him to parks, but go ahead.
Because we're going to get there. Because people...
Because history repeats itself.
So people are still having sex in them, which I think is fine. I studied it in college. I wrote my honors thesis on public sex, and I was an outreach professional. It's how I got my start in HIV prevention. Was doing outreach professional in parks. And so I feel like right now, the only conversation I get about gay sex is from heated rivalry or from prep ads, right? And so, first of all, do you have a favorite park for sex?
Yeah, the ellipse at the White House.
There we go, the ellipse at the White House. So hang out there. I'm sure you're going to get great quality trade. The best trade ever.
Any questions? I'm ready to thank myself. Go ahead. Keep going. This is so many questions.
But no, can queer activists ever get the public health system to talk about the sex they're actually having? I think that's why this is important. You talk about history repeating itself, right? And there was a period in that era, and I'd love you to talk about your work in New York, really elevating conversations to talk about pleasure.
Yeah.
But then at the same time, we're stuck in a period where I feel like we're moving away from any of those conversations, where we're starting to suppress a lot of that.
Yeah, no, I think we're in that era again where we're doing euphemism, where rather than sort of like saying things overtly and very clearly because of the sort of political environment and the weirdness we live in, somehow we need to bury it in words that don't necessarily reflect what we're really saying. And I mean, again, like in the heated rivalry era, where their in effect was like, and God bless softcore porn on television. God bless. It's good.
I'm sorry.
Listen,
It was a show.
Hockey players had great butts.
Yes, they do. Bad teeth.
Right. Shout out Connor Story one more time. We see you. But I mean, I think in the era where you have this like one thing where we're not able to talk about sex and sexuality yet, like the media is like all about like gay sex and like queer people. It's like this moment where you have to say, I'm really glad that you're enjoying sibling rivalry.
Wait, that's a
totally different movie.
But heated rivalry, like you have to say, I'm glad you enjoy that, but you need to get up out of your seat and like actually support the communities that this is like an important part of their lives. I mean, like being queer, your sexuality is an important part of your life. Like sex is an important part of it. And so I think that you can't have just the chocolate and the peanut butter. You have to have the chocolate and the peanut butter, right? You've got to like be able to sort of have this thing in the media, but also realize that you need to support the communities by really giving us the option and the ability to talk about our sex lives in a way that supports our joy.
Well, I mean, I think fetishizing, that's the problem. We fetishize what we don't know, but we fetishize what we think about. Because I say this to guys all the time. I'm not just a sex symbol, and I'm not just a fetish. You know what I'm saying? I want someone that's going to get to know me for me. It's the same thing with What's the name of the show again?
Heated rivalry.
Heated rivalry. Look, I know it was a rivalry. I done seen it. It was kind of heated though. For a second. I mean, especially the one with the one that came out for his lover.
Oh, yeah.
Cute. But it was anticlimactic because he didn't do nothing afterwards. I was expecting a gay wedding and are you going to be the open NHL gay couple? It's a lot. Anyways, but
Maybe that's season 2.
Maybe that's season.
that's if it gets picked up. That's if it gets picked up.
And it becomes more like Bridezillas for gay hockey players. Is that
But it's crazy.
I think that's great.
It's crazy.
I'm telling you, man, I want some royalties on that. I'm gonna throw that out there right now. I think my concern is around the saccharine quality of it.
Yeah.
I think my concern is that around the sanitized version of it, because I think that there is a fascination, like you said, there's a sort of, you want to watch this happen. That's great. At the same time, you have queer people's rights being removed. You have attacks on our trans community members. And so if you're going to be an advocate and you find this story valuable, then also remember that the human beings behind it are also valuable. And so as allies, like show up in these spaces, like show up in these political environments.
Right.
And that's what I fear is not happening. I fear what we're seeing is a repetition of history where I know you've shared, Mattie, in the past around
In the 70s, the exploitations of Black females. And it was, like I said, it's just one of those things where you fetishize it, but then you diminish them in real life.
Yeah.
You give them this platform to look beautiful, but then we're going to take your rights at the same time. So it's almost watch the left hand or the right hand so that you don't see what the left hand is doing. And I think that's some bullshit.
Yeah.
But I also want to go back to something you said earlier. You talked about he was a double major in religion.
Yeah.
So I'm interested to know, one, religion and science, how did that even go together? And two, does that play a part in your community outreach now?
Yeah, I mean, I like came upon being a religion major kind of by accident. So again, I went to Columbia. I think I told you that part of the story. But, Columbia, like I said, I think that they probably need to. They're a little child.
I mean, let us say the name. How many times they're welcome.
And so they did.
This show was brought to you by Columbia.
In the city of New York. But so that university has a core curriculum. So I went there to be a science major and to be a pre-med. And then they had me take humanities classes, like literature and humanities and contemporary civilizations. And you could take another class. And I decided to take a religion class. And I walked in, I was like, let me take Buddhism because I don't know anything about it. And I walked in and it was a class being taught by Robert Thurman, who is the preeminent scholar of Buddhism in the US and Uma's father. And it was a great class. And I was like, wait a minute, I'm starting to understand about people's worldviews. This isn't just about religion or a God or a scripture, but I'm understanding a worldview better. And I totally fell in love with that. And little baby Dr. Demetre, Dr. Demetre in the class was like, I should do more of this so I can understand people better so that it makes sense when I'm a doctor, I get to know more. And so that's why I did it. And I think that it influenced so much of my work because I go to a community listening more than assuming because that's what you learn in that training, in that sort of religion major, that you need to sort of understand a worldview, not by assuming things about it, but by listening. And I got to tell you another good story. One of the fun parts was at the end of this class, Dr. Thurman was like, oh, we're going to have a special guest. And I was like, oh, what celebrity is it going to be? Uma.
I mean, how many
right. And I was like, I want this.
What's an Ivy?
The red jumpsuit.
Yeah.
All of it.
Oh,
well, anyway, either there's so many Umas that I would have liked. So then the door opens and it was the Dalai Lama walking around. And I was like, he was touching our heads and laughing and being so sweet to us. And I was like, I don't know how I can't do this double major because it's crazy how cool this is. And so I learned
the Dalai Lama. I think I took my wig off.
You had no wig on. It was just like this. I had my Dalai Lama inspired haircut. Thanks.
My Dalai Lama inspired haircut. I love that.
Okay, we are having way too much fun, but we do need to take a quick break. We still got to pay these bills. We still got to make sure we get our stuff together. So please stay tuned because when we come back, we will be talking everything from our doctors to best patients to...
We're going to be coming back with our speed round, and we've got a question from one of our former guests. And I have a question about DoxyCount.
Okay, let's do it.
All right.
Right after this.
Your mission is vital. Let a great idea help you magnify its impact. As a queer-owned graphic design and digital development agency serving nonprofits, healthcare, and education nationwide since 2015, we're dedicated to growing, empowering, and activating your advocates. Our award-winning work speaks for itself. We deliver transformative change. Ready to see your impact grow? Book a session and let's get started at agreatidea.com. That's agreatidea.com.
Hey, this is Sean Aaron, he, him, his, and I'm here to tell you about Them Boys Podcast. I'm the host of Them Boys Podcast, and as a Black queer trans man, the podcast amplifies the voices of other trans men of color as we share our transition stories. The podcast not only amplifies the voices of trans men of color, but it raises awareness and conversations around our lived experiences. You can listen to the podcast by going to themboys.org/podcast. That's DEMBOIS.org/podcast. I hope to have you join us on the next episode.
Welcome back. This is Power Beyond Pride, a queer change-making podcast. I am Shane Lukas. I'm here with my phenomenally beautiful and elegant co-host, Mattie Bynum. And we have with us really just a leader in community health, guidance, just innovation, everything, Dr. Demetre Daskalakis, who joins us live here in the Great Idea Studio, which is wonderful, in Greensboro, North Carolina, where little young Demetre got his Fisher-Price start. So shout out also again to Fisher-Price.
Yeah.
We'll give them a shout out.
Okay, so Dr. Demetre,
Yes.
in your current role at Callan Lord, I said it correctly.
You sure did.
In New York, you are continuing to work closely with communities that have historically been underserved, and ignored by healthcare systems.
Yeah.
What are your goals in this new role?
Yeah. I mean, so first, Callan Lord is the global leader in LGBTQ health. It's a community health center, but it finds its origins in the Stonewall riot.
Yes.
So it goes way back, deep to the roots of the movement. And so my goal there is what the goal is of the actual community health center, which is to really continue to deliver on the mission to make sure that we provide care to the LGBTQ population in New York. And for me, I come from doing big public health. I also think that in this era, being in big government, you don't get anything done because it's kind of stagnant.
Mhm.
And I am so hungry to be at the grassroots again, to be able to sort of not only do it for the person and the patient in the room, but also to create the blueprint for how LGBTQ health is delivered in this country and the world. So I am obsessed with that place. It's amazing.
I love you. Again, Callan Lord is a phenomenal organization. It's named after Michael Callan and Audre Lorde. I think it's important to note. Again, leaders just in queer liberation movement, change makers themselves.
Yeah.
And I think for me, incredibly powerful. Michael Callan's obviously very famous for his writing around how to have sex in a pandemic.
Yeah. That's the original, the OG harm reductionist.
Not the OG, wait a minute.
Oh, absolutely.
That's original gangster.
Yes,
So the original harm reductionist. And then Audre Lorde, just such a powerhouse, poet and an essayist and a musician and advocate. Essayist, poet, and advocate, and then you slam them together and make the most amazing community health center in the country. It's magical.
I think it's brilliant because it's also really speaking into this moment about how public health and science really are part of the liberation movement. They are part of the work. And actually that leads me to a question that we have from one of our former guests. Dr. Shunte Zhao shared with us a question. In science, they're an amazing person who's working on a lot of these issues, including around HIV. And so they sent in a great question, which is to say, as an educator, I train many young scientists and physician scientists. Some of them, particularly those from the LGBTQ community, feel discouraged by the current uncertainties around funding and research. From your experience, what can mentors and educators do to better support and encourage the next generation of queer and BIPOC scientists during these uncertain times?
Yeah. I mean, I think it's important to start by recognizing the trauma, right? So this is a hard time. And so there's no way to sugarcoat it. The funding is wild. Our communities are being attacked. Some are being erased. But our ability to engage in science and scientific discourse is activism, right? So this is the moment where my advice is to hang on. Educate yourself. Do what you need to do to become that strong scientist so that you can be a part of the future. So right now it's hard, but what's going to happen is going through this, persevering, although I'm not a big fan of the word resilience, like being resilient to make sure that you get to the other side means that you're going to be there to really be the blueprint for science and for future scientists. So we need you now more than ever, because there's going to be such a gap created because of the attack on science that there's going to be a role for you, and that is leadership. You're going to have innovations, have new discoveries, change the way that medicine is done or any other part of science, and you're going to be the leader. And what you're going to do is make sure that this that's happening now never happens again. And so your leadership is so important. So don't give up. And it's not going to be easy. No way to sugarcoat it. But there is a prize on the other side, which is that you're going to defend the communities that you love.
You know, you said you don't like the word resilience. I thought of while you was talking was persistent.
Yeah.
Stay persistent. Stay hungry.
I think better than resilient. I feel like one of the things that I think we do a lot, not just in LGBTQ space, but in public health and other places, is that we tell people to be resilient, and they're asked to be resilient because the systems that are supposed to be resilient to support them fail. And so that's why I think persistence is an even better way of saying it. So don't give up, be persistent, and demand a resilient system in the future that doesn't let this happen again.
Or even a system that isn't trying to oppress or harm you.
Right.
Yeah.
Right.
Like the system's strength is important, but also systems that are fundamentally built to not help you thrive.
Yeah.
Also need to be changed.
So listen.
This is real Demetre coming. This ain't Dr. Demetre.
So when I was a kid, like I was relentlessly bullied, and that was hard. And I think in my youth as a little baby Demetre, decided that I really didn't like bullies. And so in this era where we're all being bullied, I think make the choice that you don't like bullies and make sure that the space is one that is unsafe for bullies in the future. And so that is like the power that we have. And so period.
Change making. That's change making.
So just like, I think that when you're being bullied, I remember I have so many stories in high school that like, I just decided that instead of being bullied, I would be their class president and like, be the editor of their yearbook. And so that's kind of the thing that launched me in all these directions of leadership, which is actually, this is a good story. Somebody said to me, I don't trust you because you're in government. And I responded and I said, you should trust me the most because I'm in government, because I don't trust it either. And so, that's right. So that's like the point that as you're feeling bullied, like this is the moment that you're going to persevere. And that through that perseverance, you will create a place where it's not safe for bullies to do this to people anymore. And so don't give up.
Don't give up. Yeah.
Can I piggyback on that? I have a question, because you just said something that was really powerful to me, because I feel like one of the challenges that we have, or in this current moment, I'd be curious your thoughts on this.
Sure.
That comment really sort of lives into this. We position now the government, and I remember growing up in the 80s in the Reagan era, and there was this very anti-government sentiment. I think it came out of maybe the Nixon era and some of the other stuff. Like, part of it, I think, is a reset about what the government is. The government is supposed to be a contract among our citizens, among all of our neighbors, among all of our people, that there are things that we individually cannot do. I can't run a school district or get lights to move. So I want to work as a public contract to make sure these things are there.
All together.
But this anti-government sentiment, like that's the part I think, that distrust in there, that I don't know if we've ever talked about what an imagination of a system that worked looked like.
Yeah.
Do you think we're missing an imagination of what is possible because we're so busy critiquing what we have?
Oh yeah. So here's okay. My glasses are here's the deal.
Teach.
I feel like there is in public health so much effort to try to save systems. And we need to zoom out on this for a second and say, what are you actually saving? Right? If the thing is so easy to destroy and weaponize, then let it burn and figure out what the new thing is going to be. And so that, I think, needs to be stimulated from the community. And whether that means like more like local strength, more local dominion over the things that we do, with the federal government doing what it really should do, which is just to support the good work that's happening on the ground rather than to stymie it or to try to limit it. So we should think about not just salvaging, we should think about reinvention. And so I feel really strongly that as you see things being destroyed, maybe that's our opportunity in that destruction. He's a religion major. And that destruction, yeah, get ready. That destruction to find creation. And so very often in a lot of religions, when they talk about like a destructive force, that destructive force is also the creative force. So we either can sort of lick our wounds and cry or say, okay, destroy it. We're going to build it stronger and better and like actually more responsive to the needs of people. And so that's in healthcare as well as in other parts of government.
But now, okay, so here's my thing.
Yeah.
You said two things that traumatized me.
Okay.
And
Not what I was looking to do,
saying,
but it's good to talk about trauma.
because so here's my thing. When you say a new America, because I definitely agree, the system we have is screwed, is demolished. So we do. But anytime someone says tearing down what we have and saying a new America, I always go back to the purge and think of the new founding fathers. And that's the trauma statement, because it's okay, that's cool. But where is your narrative? Like, what is going to be your new? Because new for you may not be new for me.
Right.
And so we need to come together all the way. Because I do agree with you. I think at this point in the game, there is no saving it.
Yeah.
I think this is one of those situations, excuse me, God, but we need a good flood. I'm just going to be honest.
What should it have been saved? And I know we have to. We're gonna jump off into our speed round in a second. But I do think that the system never worked perfectly for everybody, and I think that we have to acknowledge that was never the case. And what I guess I want to draw attention to, and I think what you said is, anti-government, we've created this idea that the government isn't us.
Right.
And I think that there's an opportunity for people to take back part of the government, to run for offices, to take, like you're doing, to be in these spaces and say, actually, these systems aren't away from me. They are actually things that I have access to, versus like corporations and other systems. Because what I worry about is we elevate corporations in the face of government, and those we don't get to go in and run for office for. Those we don't get to control. Whereas government, theoretically, is a space in which we as neighbors and people can go into communities and take.
So like I back in the day, I used to think that there was like three things that you would need to do good public health. And so I use public health as the example. So I would say that you need good science that was implementable, you needed political will, and you needed community engagement. And then I revised it based on my experience now, which is not just science and political will and not just engagement. What you need is community co-creation. And I think that that is sort of the place that answers the trauma, which is that as this thing is moving in a way that like it's not serving us anymore, like any activism that we do is going to be important in redesigning what the next thing is. And so I think that sort of conjuring Michael Callan and the Denver principles, like we need to be at the tables that are redesigning this. And that is something that we just can't look at and say, we hope someday we're going to be at the table. This is going to take radical action to demand to be at the table. And let me tell you, that's muscle memory for us.
It is. No,
that is 100% muscle memory. And so I think that that's going to be what the call to action is. But then also, because of my age, my senior age, I'm able to say this, but it's like my advanced years. Even I think, was a little bit young for seeing the community that rose up against like the tyranny that resulted in people dying because of HIV. I sort of saw the tail end of it, but let me tell you, it must feel like what we feel like today. And I'm like, I realized that for decades, I sort of thought of community and saw its avatar, and now I'm actually in community. It's kind of amazing because I'm like, wait, this is what it was like to be Mark Harrington and Peter Staley storming the FDA, because I feel like we're storming the FDA again. And it's like, that's what needs to happen.
And let's do it. Let's do it. We need to do it.
Yeah.
We need it for change.
And then you're at the table.
Yeah, no, I get you. And it's funny that you brought that up, because when I think of that time of our history, it's funny how we think of it as the epidemics and the pandemics that happened at that time. But I always get lost in the ball scene, and I'm just sitting there thinking to myself, like, it may have been a bad time, but we found such beauty. Yes, beauty, such love,
right? Like
community.
So children, Paris is burning.
Oh my God, yes.
Watch it.
Oh my goodness.
Because I just feel like that was like in this terrible era of the world falling apart, and it was just such beauty. Let me touch the skin, touch all of it.
And I want to take that beauty and move it to a whole nother beautiful level, if I may, because obviously this conversation, it's been so great to spend time with you and talk about this policy and this important work. I want to move us to the next round of beauty, which is
the speed round.
Learning more about you and your handsomeness. So,
Oh my. Dr. Sweet Cheeks.
Dr.
Well, you know, I said that when we came back in. So let me say, Dr. Ford.
Oh,
Dr. Ford. So, Dr. Ford, in my first question for the speed round, I think this is a good question. It's going to be a little lengthy, but it's worth it.
Okay, I'm ready.
Everybody's having sex.
What? What?
Child, bye. If they not, we wouldn't be here. I'm serious. Everybody's having sex. But no, we talk so much about safe sex.
Yeah.
How can you have fun, enjoyable sex and still stay safe?
Yeah, I think that you need to think about all of the ways that you can prevent the stuff that interferes with you having a lovely sex life, right?
Yeah.
So, I'll come at it from the infectious disease perspective, which is HIV and STIs and sexually transmitted infections were things that really made sex like full of fear and worry. Now we have this giant toolkit of ways that you can prevent those things. So if you want to do things that maybe don't expose you to STIs, in the park, a little jerk and tug and stuff.
That's the name of our new band, by the way. We're Jerk and Tug. I'm Jerk. That's Tug.
I'm Tug.
And that's the episode I'll be serving in later. But okay.
So there's like that stuff. But then if you want to have sex that could potentially expose you to stuff, you've got like, you can take a pill a day to prevent HIV. If you don't want to take a pill a day, depending on like your circumstance, you can do you can do it. You can do like 2-on-1 prep or prep on demand, which is take a couple of pills before sex and then a pill a day for the couple days after. That prevents it too. You're like, I don't like pills at all. There's injections that can make
I'm uninjectable.
There you go. You also for STIs, you can use doxypep, which is antibiotics that you can take after sex, and it prevents gonorrhea. Not as great, but chlamydia and syphilis pretty well, and it works.
Is there any, just a side note on that, is there any concern around what they consider bacterial resistance or anything around antibiotic resistance?
Yeah, so this is when it's really fun not to be in government and to just be like an activist physician and say, people prescribe doxycycline, which is the drug that you use for doxypep, all the time for people's zits. And people will take it for their zits for a long time and not one word about the fact that there could be resistance because of taking it for zits, but everyone is worried about resistance when you're taking it to prevent infections that you can get through gay sex. So let's face it, like it's always been a problem. And so if it is a problem, that's great, but STI is an emergency. And so let's use doxypep for the emergency and take care of the rates of STIs in the country.
Sounds like a great strategy. Thank you for just that. It's definitely one that comes up. But this comes up too, if you've ever been around me for a minute, cookies or cake?
Totally cake.
Oh, yes.
And mainly frosting.
I don't understand.
What kind of frosting?
The most disgusting Costco frosting. Buttercream extravaganza.
Yeah.
So it's so sweet that when you eat the frosting, it crunches.
American buttercream, yeah.
Oh, I'd say I like that initial crunch, but then I can only have 2 or 3 bites and it's out.
That's
so
best.
no.
Listen,
The only reason I go to bridal showers and baby showers.
listen, Costco cake, the one with the frosting balloon on.
Yeah.
You don't have to eat the cake. You can just scoop the red balloon off and eat the frosting.
Yeah.
Oh my gosh.
Shane, you may not understand this, but I will go to a party, and if they have the cake with the Cool icing, I'll be pissed off about, why'd you invite me?
No.
I done sat through this whole damn party, and you gonna give me Cool icing? Bitch, I'm fat. I want real butter and cream.
I'll know that for the
So
future.
the simple answer to your question is cake.
Cake.
Cake. Okay, so while we're staying on cake,
Oh boy.
what is your favorite guilty pleasure TV show?
Okay, here goes. I love The Real Housewives of Salt Lake City.
I'm not going to do it. Because no. Okay, so what? Prior to us recording, we had a discussion about this, and I jumped all over Dr. Sugar Britches over here, okay? Because I love Salt Lake City.
Yeah, there is nothing like those ladies going at it that I've ever seen that I love more.
I'd like to add you, because I have 2 cousins and a best friend, and we call every Monday or every Tuesday and have conversations about
Yeah.
Housewives of Salt Lake City. Like, I promise you, no, like all the Housewife franchises are okay, but Salt Lake City is truly superior.
Atlanta was my entry drug.
Yes, it was.
It was the one that brought
Yes,
me
it
in.
was. Yes,
Like,
it was.
shout out to Candy Burris. Like, love her.
Nene all day.
Totally like the entry drug.
Yeah.
And then Salt Lake City happened.
I mean, you got espionage, you got people going to jail for embezzling, and you got people mad because I got a Cartier watch.
It is.
Your husband's got gout.
Yeah.
Dick. Oh my God.
Oh, yeah.
Oh my, it's so.
The secret circle jerks. Oh God, you got.
And what you would do to get tickets to a basketball game.
Right. Now you're.
Man, you're going to have to watch it. I want to move on. You're going to have to watch this.
Circle jerks.
Yeah, I want to have to watch it. I do have to say this real quick before we move on. In honor of Mary, because we're talking about it.
Yeah.
One of the ladies on Salt Lake City Housewives, Mary, what's her? I can't think of her last name. Crosby. Her son committed suicide actually last month.
Yeah.
So we definitely want to very sad silence for her.
That is very sad. Now I'm afraid to ask my next question, which is not a very fun. It's really a that's a moment of silence for that. And then we're gonna go to one phone number you won't delete, but know you should.
Okay. Let's see.
Better not be mine.
I don't have your phone number yet.
You will have to.
See, I knew it.
Oh,
That's what I'm not going to delete. We're good. We got it. So I feel like I think that I have a mentor. This is who I passed away, and I still have like emails from the mentor as well as the phone number. And so I should delete it because I'm not using it, but I will.
okay. I mean, that makes sense.
Yeah.
That's beautiful. That makes sense.
I won't say nothing else.
Mainly because the phone numbers that I should delete, I'm really good at deleting. You can take that to mean whatever you want.
Like I told you earlier, I just changed my number.
Yeah.
I'm over it. Just move on. I contact the people that need to know.
That's called to really being in control. You're like, what number?
Exactly. I'm like, no, you're not going to keep calling me. Okay, so last question for me. I will say, and this is a doctor's orders to everybody, so please listen to this question.
Yes.
What's one thing everyone listening and watching us should do for their health this week?
So I just saw a patient that this came up. Like someone came in at Callan Lord looking for a doctor's form to be filled out, and they hadn't been there for primary care for a while. And so part of the conversation is like, we'd love to do all the primary care, and they weren't able to stay, but they scheduled an appointment to come back. But so that I think is the thing that everyone should do is like just think about, am I up to date?
Yeah.
Have I done my like annual physical, the routine thing that I need to do? Because so much work gets done there. I mean, like I drive a car, and whenever my car like has a little thing that says, Demetre, it's time for your maintenance, but maybe we remind them that this is the reminder.
Yes.
Just check to see when the last time
Get you a
doctor.
PCP.
You got it. Do your primary care.
Love that.
Vaccines, prevention, all of it.
What does Power Beyond Pride mean to you?
It's a great name. So number one. So I think that when I think about pride, that's like something that is like rainbow flags and sometimes corporate America. And what we sometimes forget is that what is the foundation of pride is the power of our community.
Yeah.
And the fact that we are survivors in the most amazing way. And that power is really the source, the root from which all of the pride comes. And like when you think about our community, I think that there is like a little narrow band between power and joy. And so I think that all interplays to, do exactly that. Power beyond pride.
Love it. Joy is descent.
I love it.
I love it. Joy is powered. I love that. That's beautiful. Thank you so much for being here today. It just means the world to have you here, to share your expertise, to just hear your stories, but also your insights about where we are in this world. So thank you.
Yes, Dr.
Thank you.
All right. Look here. I haven't had a good time with you today. So I do have a quick question for you. Where can people meet you and get to know you and things about you?
I feel like the best one is my best social media is Dr. Demetre on Instagram. And so that's DR like doctor and my name, which is Demetre. It's a great blend of shirtless pictures and public health.
It really,
and the gateway to OnlyFans, I think, is my guess.
Listen, never say never. Never say
100. That's actually a good.
Never say never.
Never say never.
100%. And we could also follow Callan Lord as well. And they're so we encourage that.
Oh, wait. One big plug. A plug.
Yes.
A plug.
Not that kind.
Not that kind of plug. One big plug is if you're a medical provider, a nurse, a doctor, a nurse practitioner, or if you're a social worker, Calvin Lord is hiring. So that's CALLEN/LORDE.org. Look at our job opportunities and come to New York.
And also, you can look directly at our webpage. We'll have a link to
PowerBeyondPride.com?
Yes, Power Beyond. That place.
That one.
Yes. And on that note, I am one of your amazing co-hosts here at the Power Beyond Pride Show, Mattie Bynum. I love doing what I do. Have a great time all the time with you.
Where can people follow you?
Please don't follow me. Look at it. I promise you get scared sometimes, but you can come and view me. Yes. And Instagram, Mattie Simone 737, and also at Facebook, Mattie Bynum.
And I am your co-host, Shane Lucas, and I'm the owner of A Great Idea, a lifelong harm reductionist and bodily autonomy activist. You can follow me at shanelucas.com. I could not be more grateful again to be in community here and having these conversations. Remember to subscribe and get your friends to subscribe to Power Beyond Pride on Spotify, Apple Podcasts, or wherever you get your podcasts, and check us out on powerbeyondpride.com.
And Power Beyond Pride is a project of A Great Idea, a queer-owned design and content agency. So learn more about them at agreatidea.com.
And what else do we have? We are part of the podcast on co-host team. I should know this. Mattie and we are part of many co-hosts across the country, so we invite you to join. Send your questions and comments at powerbeyondpride.com.
And this episode is produced by the one and only Shane Lucas. It was developed by me, Mattie Bynum, and we have two of the best editors, Jared Reddy and Ian Wilson. Thank y'all. We couldn't do it without you.
You can check out new episodes each week. Yes, we do love you both, Ian and Jared. Check out our new episodes each week, and we look forward to queer change making with you next time. Thank you, Dr. Demetre, for joining us, and thank you for joining us at Power Beyond Pride.
Hey, nonprofit leaders, change makers, and community builders. If you're navigating growth, equity concerns, or just trying to make your work better, you need to know about Orange Cap Consultation, a boutique consulting firm led by me, Melody KG. Orange Cap offers community-rooted consulting to help mission-driven teams move with clarity, equity, and have a real impact. Whether it's strategic planning, meeting facilitation, leadership development, or helping you design community programs, I've got the experience and the heart to help you build what's next. Learn more at www.orangecapconsultation.com. Are you looking for a way to make your philanthropy more meaningful and more aligned with social justice? Meet New Moon Network. New Moon helps individuals, institutions, and foundations move their dollars where they matter most, into grassroots movements advancing the rights and self-determination of people in the sex trade. If you're a funder ready to move in solidarity with sex workers and survivors, this is your invitation to come learn about our movement and help fund meaningful advancement for sex workers' rights. Reach out to us today at contact@newmoonfund.org and take the next step toward funding with purpose.